Today I am going to discuss about the analytical department, regulatory audit observation and style of responses. See the observation. The statistical quality control criteria fails to include appropriate acceptance and rejection levels, especially in the procedure for receiving an inspection of the compound components and packaging material that follows an that is unspecified label of AQL of an SIZ 1.4 to 2008 with no clear criteria for acceptance and rejection level. So it's ridiculous. Has to be specified acceptance and rejection level. This is common sense. See, procedure lacks to provide clear reject and acceptance level based on an SIZ 1.4 and specific number. Response. How to respond such problem? See, this is very common sense in the AQL acceptance level and rejection level. How to respond such problems? AQL SOP is received to include reject and acceptance level. The second observation, this is failure of batch or its component to meet any of its specifications where or not batch has been already disturbed. Especially the exhibit batch of capsule failed in process test parameter and also OS investigation did not include thorough review of the failure and parameters. Scientifically failure and scientifically sound investigation in that respect. This is reported in the conclusion that it is first time in process testing as was performed for the content of the product. However, this statement is incorrect because the head of quality unit stated that the person tested the first exhibit batch of the product of the same content and waited for the test results before proceeding of the encapsulation stage of the manufacturing process. It was stated that the higher percentage of RSD is due to variation in result, but do not have data to show that the percentage of variation is not due to non-uniform content in the drug product. It was stated that the content is uniform in the capsule, but there is no database to show that the HPLC test method is capable of identifying inconsistent content in the finished product capsules. So this is a big observation. So how the USFDA auditor observing each and every problems in the analytical department, just check, try to learn. That is how they are putting their fingers, they are pointing out the problems. Not only pointing out, they are giving you solutions. That is, it did not include development of a kappa plan to prevent future content failure in the samples to ensure a uniform content in the sample. It was stated that the cause of the OS was attributed to a method that is not amenable to in process impact assessment. The head of quality unit stated the first batch of the capsule manufactured in the unit results for the content were within specifications. The head of quality unit stated that is to continue using the forementioned test method to test samples, but the person did not have data to show that the content test method can identify non-uniform content in samples or finished product samples. So this is a big observation. Actually, such type of observation, you should understand the sequence, the way I am explaining. This is the observation that is I have seen in Europe in one company. So how to respond such big response, for such big response, that is observations. You have to point out, note down what is the that is these are basic points. So how to respond, risk assessment of product done, and will ensure a uniform content in the sample. So you understand, so this is a big observations. So they stayed in the in analytical department and observed, that is step by step they have seen these procedures and checked and then make the observations. So such a big observation, that is your that is always I am telling repeatedly, your response, style of response has to be to the point, logical. When if any question queries again they send you, that is you are in a position to reply in a proper way with specific reason, specific point, data, that is with facts and figures you have to reply, you have to be logical. Thank you very much. Like and subscribe my channel please. Thank you.